Hi, everybody. Thank you for coming. My name is Grace Hemsley. I'm excited to announce Thomas Monks, who is going to be our MC for this event. And Thomas, whenever you're ready.
Good evening, everyone. My name is Thomas Monks, and I am proud to be here as a member of Down Home, North Carolina, Cabarrus County's chapter. We are a movement built by and for working people of our communities. I'm also a community advocate and a Concord resident. We come together today at a moment that is difficult for many families across North Carolina. Cuts to Medicaid, SNAP, and WIC have left parents anxious, seniors struggling, and too many of our neighbors wondering how to make ends meet. North Carolina DHHS statistics from April 2025 tell us that about 13% of households in Cabarrus County receive SNAP benefits, and about 23% of the county population is on Medicaid. But we're not here to mourn what's been lost. We are here to build what comes next. Because the story of Cabarrus County has never been about giving up, it's about standing up. And today we're here to stand up for each other. When policies fail us, it's communities that rise up. We've seen that spirit before in our schools, in our churches, in our neighborhoods, where people quietly take care of one another even when the government doesn't. That's the same spirit we're lifting up here through Down Home. We believe that our rural towns and our small cities deserve the same opportunity, the same investment, and the same hope that's promised everywhere else. We believe that Cabarrus County's future can be brighter than its present if we build it together. So we have a couple speakers here with us today who are here to directly tell us how these cuts to Medicaid and SNAP are set to affect them and the communities they advocate for on a day in and day out basis. Our first speaker, whose story reminds us that behind every policy decision are real people and real lives. Kim Delaney is the founder and executive director of Tiny House Big Movement, which is a nonprofit leading the way creating community-focused tiny home developments right here in Cabarrus County. She's a passionate advocate shaped by the values built on her own lived experiences. She knows firsthand what it's like to be uninsured, and that perspective fuels both her work and her concern about what the future could look like for people living with chronic illness facing uncertainty ahead of the cuts to Medicaid.
Thank you. Hello, my name is Kim Delaney, and I'm a proud citizen of Cabarrus County. I operate a small business and a nonprofit here, and I raise my two children. Oh, is this any better?
Yes.
Okay. I'm Kim Delaney, and I live in Concord. I raise two of my children here as well, and I have two businesses, a nonprofit and a for-profit. I'm just here to share my story. Every year, when open enrollment comes to an end, I feel a familiar pressure and anxiety, the kind that so many families in our community know all too well. I have a complex medical history. I am a cancer survivor. I live with autoimmune issues and conditions, and I'm on chronic kidney failure. With ongoing treatments and necessary medical supports, such as Medicaid and federal grants, being reduced or threatened, I live in constant fear of what will happen when these supports disappear and costs continue to rise. Over the last 20 years, my family has endured significant changes, and in every instance, our health insurance plays a crucial role. I have been blessed to work with exceptional doctors, people I trust, who understand my needs, my personality, and my determination to survive. Chronic illness teaches you many things. Resilience is one of them. You learn what is and isn't covered. You learn what medications are affordable, which doctors are in network, and how fragile the access can be, and how any time it can change. Medicaid has given me the stability to continue seeing the same doctors who know me best. The idea of losing that coverage fills me and my son with fear. For my son, getting his medication is already a constant struggle. Without insurance, just one of his prescriptions is $1,000 a month. Out of pocket. As someone diagnosed with bipolar disorder, his coverage is vital for his therapy visits and his mental health medications, and antidepressants and antipsychotics. For me, Medicaid determines many things. Whether I can afford my ongoing oncology visits every 6 weeks with Atrium, my dialysis appointments with Vida every month, as well as lab work and all the medications I have to take. With a kidney transplant on the horizon, losing insurance can instantly responsibilities and support my family. But if we do nothing, if we fail to stand up for our citizens in need, the consequences can be costly and devastating for so many families like mine. I urge you to please take a stand, to use your voice where ours cannot always reach, to protect the healthcare lifelines that keep so many of us alive. Thank you for listening and for caring about the people of Cabarrus County.
Thank you, Kim. Your courage reminds us that struggle and hope can live side by side. Next, we'll hear from Lynn Goley, a dedicated school nurse who sees every day how Medicaid supports our most vulnerable students and families. She understands better than almost anyone what provider cuts will mean for the care our communities do rely on and the lasting impacts those decisions could have on children's health and well-being.
My name is Lynn Goley. I'm a wife, a mom, a nurse, and someone who deeply cares about our community. I grew up in Cabarrus County, and Rick and I raised our 3 adult children here. I have worked for over 25 years as a nurse, with most of those years in community and public health nursing. I've been a cardiac nurse, a faith community nurse, an employee health nurse, and a school nurse. I have worked with people in our community of all ages, from 90-year-olds to 9-year-olds. I have served those who have had private insurance, government-issued insurance, and no insurance. Over my career, I have found that most people want the same things: to feel cared about, to feel safe, and to be assured that they are healthy and okay. As a nurse, my main concern is being able to get people connected to the care that they need when they need it. As a school nurse, sometimes that care is something I can take care of in the health office. Oftentimes, it's something the student needs to learn just as a part of growing up and taking care of themselves. Sometimes it's something the parent can take care of at home, and sometimes the person needs to be seen by a healthcare provider. Whether it's the doctor's office, urgent care, virtual visit, or the emergency room. It is important to me that students, staff, and families have easy and affordable access to medical care when they need it. I'm concerned that we are going back to a time that patients have trouble getting in to see a provider because they have limited or no insurance. When the children and adults that we are helping don't have insurance coverage, our hands are tied. When we know that someone needs to be seen by a provider but can't access care, we can refer them, but there may not be anywhere that they can go. Or they must go to the emergency room, which isn't the best use of healthcare resources. When a patient can't access care or get the medications that they need, the consequences can be serious and even life-threatening. It is better for everyone, including the patient, when someone has a regular provider that they can see when they need it. That involves the person having a doctor and being able to afford the visit. Medicaid meets that need for many in our community. Medicaid has been underfunded by the North Carolina General Assembly this current fiscal year. The shortfall has forced North Carolina DHHS to decrease reimbursement rates for services across our state from 3 to 10%. Lower reimbursements can cause providers to see fewer patients or decline accepting Medicaid patients altogether. I remember past years when it was difficult to find providers who were accepting Medicaid patients, or at least new ones. Our families deserve to be able to be seen by quality providers in our area, and our providers, including clinics and hospitals, deserve to be reimbursed fairly for the services they provide to patients. While many of these decisions are being made at the federal and the state level, we are asking that our local elected officials agree that healthcare access should be protected for all of our county's residents, and that we can work together to find solutions to keep all of us healthy and thriving. I appreciate that our county commissioners will be addressing this issue in tonight's work session, and I look forward to hearing how our community works together to support each other during these uncertain times.
Lynn, thank you very much. Next, we'll hear from Rachel Phipps, who is a tireless community advocate who knows these challenges personally. As someone living with a chronic illness, she's seen how vital Medicaid expansion has been, and she's here to talk about what's at stake if progress is rolled back.
Good afternoon, everyone. My name is Rachel Phipps, and today is my birthday. But more than a celebration of life, Today is a testament to survival, resilience, power of policy to save lives. I live with 2 chronic, life-altering illnesses, lupus and MS. These are not just diagnoses, these are daily battles. And I'm standing here today because of one thing, Medicaid expansion. Without Medicaid, I would not have access to life-saving medications, treatments, and specialists that keep me alive. My medications alone would cost me over $6,000. Without Medicaid, I may not be here to speak to you, to advocate, to organize, to teach, or to fight for others who are still waiting for care. Medicaid just didn't give me health care. It gave me a chance to be a part of society again. It gave me purpose. Because of Medicaid, I returned to school, earned my master's degree, and now I devote my time to advocacy, fighting for the poor, the working class, and those who are often left behind in budget negotiations and policy decisions. I fight for those who don't have the strength to stand at a podium, because I know what it's like to be too sick to speak, too broke to afford treatment, and too invisible to be heard. But I'm not invisible anymore, and neither are the thousands of North Carolinians whose lives hang in a balance as lawmakers debate budgets and allocations. I am calling on our elected officials to pass a budget that protects and expands Medicaid, fund the programs that keep people alive, make the allocations that ensure our neighbors, our elders, our children, and our disabled community members can fight another day. This is not just policy. This is life and death. On my birthday, I ask not for gifts, but for justice, for accountability. I ask for compassion in legislation, and I ask that we remember, behind every budget line is a human life. Thank you.
Rachel, happy birthday. Thank you. So we've heard multiple stories about Medicaid cuts and how they are going to impact our community. Now I would like to introduce you to Denisha Polite, a mother of 3 who has navigated the challenges of recent cuts to SNAP and believes that no family should ever have to choose between feeding their children and paying their bills.
Hello, my name is Denisha Polite, and I am a 37-year-old mother of 3, living in public housing in North Carolina. I've been receiving SNAP benefits for over a decade. They have helped me feed my children while working and unemployed, and also while building my life. This past October, my benefits were delayed. I've waited, unsure if they were going to come back, and now I've been told they might not come. That uncertainty is terrifying. I've lived through this before during the pandemic, and I remember the pandemic. I remember staring at empty cabinets in refrigerators and wondering how I experienced to my kids. I tried to take matters into my own hands and started to learn how to garden. I wanted to feel like I wanted to do something, but food doesn't grow overnight, and the cost of living keeps rising. The cost of everything is just disturbance to my livelihood, and my kids, they enjoy fresh fruit. They love the meals that take long. They do not understand hunger, but I do. I know what it feels like to be worried every day and about how it feels to feed them. Without SNAP, I'm not losing just food, I'm losing a peace of mind. I'm losing sleep, I'm losing the ability to focus on anything else, and I'm not alone. There are thousands of families like mine quoting the same story. I'm calling on our elected officials, our community leaders, and any bills to fight for SNAP. Fight for SNAP. Don't let our children go hungry because of the need of budget cuts. We need action, we need compassion, and we need help.
Thank you, Denisha. And we do have one more speaker. That is BP, who is a 20-year resident of Cabarrus County, and he's also going to be talking to you a little bit about SNAP benefits.
How y'all doing? BP. I've been living around here for about 20 years, and I feel that if we uplift the lowest part of society, then society as a whole benefits from it.
Okay. Yeah. I'll give you some free help. Get your hands up. Get your hands up.
If you could please step to the side or something a little bit closer. Step to the side. If you
That's
could
okay.
please step to the side.
We're streaming live.
Straight up here.
If you could please leave them alone and go about your day. If you'd like to join the press conference and talk with us, we're welcome to talk to you over here. If not, I hope you have a great day.
Yeah, if you uplift those people, society as a whole benefits.
Well, no, nothing like that.
That's pretty much it. We all know someone, the person who's not technically firefighter, EMT, regular people, and if they're not directly affected, then they know it. So keep that in mind as you go through the Cabarrus piece.
So I want to thank all of these amazing members of Down Home North Carolina for coming out and sharing their stories. They remind us why we organize, because no one should face hard times alone. I would also like to take a moment and thank the North Carolina Attorney General, Jeff Jackson, who has taken the current administration to court to force them to provide the benefits for staff. And just out of this morning, there was an announcement that he will be providing, that the federal government will be providing 50% payments on November's benefits. And he is promised to still keep fighting for 100% of those benefits coming out. So we acknowledge these cuts are already being felt by more and more Cabarrus County residents every single day. In this season of harvest, thanks, and giving, too many families are facing the uncertainty of not knowing where their next meal will come from. It's a reminder that behind every policy delay are real people, parents, children, and neighbors who deserve stability, dignity, and a chance to thrive. We do not have to accept a future of less. We can choose